breakdown of a truly remarkable medical profile.
Okay, let's dive into this. What in the world connects suspected cervical malignancies, severe passive bleeding, and kidney stones? I know it sounds like a totally bizarre medical riddle, right? Well, what we're exploring today is not just some simple plant. We're actually looking at a really profound systemic disease condition that requires a highly specific intervention.
Think of this as our patient chart for the day. First, we'll look at the overlooked clinical profile. Then we'll examine Profile 1, passive hemorrhage, followed by Profile 2, renal colic. After that, we'll dive into the patient's mental state, compare active versus passive bleeding, and finally, piece together the complete remedy picture.
All right, let's start with Section 1, the overlooked clinical profile. To really understand this condition, we've got to look right past this remedy's narrow reputation.
So, Thlaspi bursa pastoris is commonly known as shepherd's purse. It's a small medicinal plant in the mustard family, and its name actually comes from the plant's triangular, flat, purse-like roots. Now, traditionally, clinical practice has kind of pigeonholed this solely as a female remedy. But, as you'll see in just a minute, it actually treats deep systemic pathologies that go far, far beyond just isolated gynecological complaints.
Moving on to Section 2, Profile 1, passive hemorrhage. Imagine we're opening up a medical dossier right now on a patient suffering from absolutely unrelenting blood loss.
This brings us to Dr. Rossel's first case. We're looking at a 48-year-old female patient who is literally facing a hysterectomy due to a suspected cervical malignancy. And her physical symptoms, they were incredibly intense. Her menses were protracted, lasting anywhere from 20 to 23 days. Think about that, leaving her with a tiny 4 to 5 day gap before the whole cycle just started all over again. As you can imagine, this led to severe anemia, tachycardia, and a state of utter weariness. She was experiencing severe crampy hypogastric or lower abdominal pain, specifically when passing clots. On top of that, she presented with a chronic offensive bloody leukorrhea, which is a form of vaginal discharge. So we're not just talking about a heavy period here. This was a profound state of exhaustion and severe pathology.
So how exactly was this handled? Well, Dr. Rossel's clinical approach was highly structured. Step 1. Tackle the acute bleeding immediately. He utilized Thlaspi and a 12C homeopathic potency alongside biocombination 15. Step 2 involved vital auxiliary diet measures. Rather than just relying on standard supplements, he recommended green vegetables, jaggery, apples, and dates to actively build up the blood supply. And then step 3, address the underlying constitution, but only once the patient is stable. This methodical approach reportedly stopped the patient's bleeding by the 3rd day, improved her appetite, and brought her heart rate right back down.
Now, skipping ahead slightly for context, let's look at Section 5, active versus passive bleeding. This is an absolutely crucial differential diagnosis tool for recognizing this specific disease state.
And this brilliantly illustrates the critical difference between active and passive bleeding. Active bleeding, which is typical of a remedy like Trillium, features bright red blood, increased arterial pressure, and a total lack of clots. But Thlaspi? Thlaspi represents passive bleeding. Here, we're talking about dark, clotted blood that just continuously oozes. Why? Well, because the blood is coming from a relaxed or bulky uterus that has lost its muscular tone. So the blood stagnates, forms clots, and then that severe cramping we talked about, that happens only when the uterus struggles to pass those clots.
All right, circling back to Section 3, Profile 2, renal colic. We are completely shifting gears here, moving away from gynecological complaints to explore the urological system. Take a look at the urinary disease profile from a 48-year-old male patient suffering from severe renal colic. He experienced severe, crampy, lower abdominal pain while passing urine, but the true defining feature here is the sediment. We're looking at copious, brick red, brownish, bloody crystals composed of phosphates and uric acid. And all of this is accompanied by a really strong offensive odor. This specific presentation utterly shatters the misconception that this remedy is exclusively for female complaints.
In fact, William Borick's homeopathic literature makes a pretty bold clinical claim about this plant. It says it, quote, often replaces the use of catheter. This applies specifically to elderly patients who have lost bladder tone and suffer from continuous dribbling of urine, even when there's no physical obstruction. It really highlights the remedy's profound ability to restore lost muscular tone in the urinary tract just exactly like it does in the uterus.
Let's move on to Section 4, the patient's mental state. It's time to connect the severe physical pathologies we just discussed to the patient's mind.
Let's examine the mental rubrics, or the psychological symptom categories derived from the symptom-matching process of that male patient we just talked about. He was continuously complaining about his illness, just completely stuck in a deeply confused state regarding his disorder. And what's truly fascinating is that his confusion was actually aggravated by closing his eyes. Furthermore, he explicitly stated that he felt much worse when he tried to just overlook or ignore the problem. When you combine that with an aversion to work due to sheer weariness, it creates a highly specific mental state of anxiety, exhaustion, and an inescapable focus on the illness.
The source material also notes some highly specific single remedy rubrics that complete this frankly bizarre psychological profile. We're talking about phrases like walking must morning and walking must far distance. These tiny, peculiar details act as diagnostic anchors. They isolate this exact disease condition from pretty much any other. It just goes to show you how granular and deeply personal these medical profiles can get.
And finally, Section 6, the complete remedy picture. So the crucial point is we need to bring all these diagnostic clues together to form the complete clinical picture.
Let's review the Thlaspi bursa pastoris checklist so you can really lock this into your memory. When diagnosing the state, look for passive, dark, clotted hemorrhages, uterine inertia or a bulky, relaxed uterus, copious, brick-red urinary sediments associated with renal colic, and that confused, continuously complaining mental state. Oh, and don't forget its surprising applications for things like sublingual cysts, known as granula, and nail abscesses, known as Whitlow. This is the exact lock-and-key solution this remedy provides for a vast, systemic disease state. We've covered some incredible ground today in mapping out this profile, so I'm going to leave you with this final, provocative thought. If a simple plant in the mustard family can mirror such complex systemic pathologies, from severe uterine hemorrhaging to renal colic and mental confusion, what other profoundly overlooked remedies are hiding in plain sight in clinical practice right now? Thank you so much for joining me for this explainer.